Hi everybody, good morning. Am I audible and visible? Hi guys, good morning. Am I audible and visible? So, welcome back to another episode. Alright, so today we are going to talk about a very important topic, which is screening. Now, as you all can see, we have finished vaccines and NIS, we have finished EPID, we have finished concept of health and disease. Now we're going to start with screening today. All the links are there on the on the Telegram group as well. All the PDFs are there, so keep following. Just a quick reminder that tomorrow we're going to have PSM images. It will be almost a 2-hour session, guys, tomorrow, but that is going to be on Prep YouTube. Okay, that will be on Prep Ladder YouTube. Don't forget to join in for the image session, because it's going to be all the images compiled tomorrow from PSM. जो भी आ सकता है, some expected questions also. Alright, so without taking much of your time, I've come up with the numerical only first question. Can you try to tell me the answer to this, everybody? Can you try to solve this? 1 second. Oh, PDF, I forgot to share again the PDF. Let me share it to you. पहले एक question करके दिखाओ, then I'm going to move forward. 1 second, okay, PDF. I'll share the unannotated PDF. Just give me one moment. I have brought couple of 3, 4, 5 questions for you to practice from screening, because screening questions are highly floating these days and they will turn up, so you have to know about it. Okay, so I've shared the group, I have shared this thing on the Telegram group. You can have a look once. Okay, everybody. Chalo, this is the unannotated PDF. Alright, now back to the questions. Okay. So over here you were asked to calculate the sensitivity and specificity. Okay. Now this is a very basic numerical. We will also try some numerical on slightly challenging side today. Okay. Now you all know what is sensitivity. Sensitivity is the ability of a screening test to identify correctly all those who have the disease. Identify all those who have the disease. Identify all those who have the disease. And what is specificity, everyone? Specificity is the ability of a screening test to identify correctly all those who do not have the disease. All those who do not have the disease. Who do not have the disease. Now, whenever you get any numerical, guys, the first rule that you have to follow is the ABCD ka order. Always remember, disease is going to be on the column side and the screening test result will be on the row side. ठीक है, जैसे एपिड में करते थे, disease तुम्हारा column side पे होता था और exposure used to be on the row side. And what is the order of ABCD, guys? All of you draw from your hands right now so that you don't forget. It's a Z. It's a Z like this. Okay, so your order is A, B, C, D. It's never A, B, C, D. That is wrong. ठीक है. Now I asked you sensitivity. Sensitivity की formula क्या होता है? What is the formula? It is to identify correctly all those who have the disease. Now, if you look at the 2x2 table, HIV present. कितनों में present है? A plus C. Right? A plus C. But screening test, ELISA identified it in A. Now, the real question is, what is A, what is B, what is C, what is D? So, A means you are HIV positive and ELISA also said that you are HIV positive. So, this is the true positive. What is B? You are not having HIV, but ELISA unfortunately said that I am HIV positive. That is false positive. So, the first row has all positives. What is C, everybody? HIV is present, but ELISA missed it. ठीक है, false negative. And what is D? HIV is not present and ELISA also said not present. So that is true negative. कैसे याद रख सकते हो एग्जाम में? Remember the order. In the first row it is all positives, in the second row it is all negatives. So sensitivity is TP upon TP plus FN into 100. Obviously you have to do it. Now over here I have already given you the values, 27 plus 3. So that is 30, and over here 27 is given into 100. Not a very difficult calculation, guys. So we know it is 90%. Now if I ask you to calculate specificity over here, what is specificity? Ability of a screening test to identify correctly all those who do not have the disease. So HIV is absent among D plus B. ठीक है, D plus B. Screening test correctly pointed out in D. That means TN plus FP. Out of that, TN. So now we know this value is given to us. 95 plus 5 is 100. We have to know 95. Obviously हमेशा multiply करते हैं. So that comes out to be 95%. Your answer was this one. Now this is the most basic question you can expect. If they want to give you one easy marks, okay, if they want to give you one easy marks, they will give you this question. कि एक 2x2 टेबल बना दिया, वैल्यूज लिख दिया, all you have to do is remember what are the formulas. Am I clear? I will give you some tricky MCQs also today for your numerical practice. We will also be doing the question that came last time in the numerical for screening. ठीक है? So अभी याद रखो sensitivity, specificity. Can anyone tell me the formula for PPV and NPV? What is the formula for PPV and NPV? What is the formula for PPV and NPV, guys? What is the formula for PPV and NPV? PPV क्या होता है? If you have tested positive, do you really have the disease or not? So probability of actually having the disease out of those tested positive. So how many have been tested positive, guys? ELISA positive? A plus B. ठीक है? Out of them, how many really have the disease? A. Or we could just be writing over here TP plus FP, out of that TP. Of course we will multiply with 100. ठीक है? What about negative predictive value, guys? Out of all those tested negative by a screening test. So how many have been tested negative by a screening test? जैसा आप देख सकते हो D plus C. So उसमें से कितनों को है this thing? It is C. So that is how much this comes out to be. TN plus FN, out of that in TN into 100. PPV everything is positive, NPV everything is negative. ठीक है? Now this MCQ was only meant to revise the definitions. This MCQ was meant to revise the formula. PPV में everything positive, NPV में everything negative. Of course you have to remember sensitivity and specificity also. Good to go to the next question. ठीक है? Alright, screening for condition is recommended men. I mean, do we have a screening test for all the diseases? Do we have a screening test for rabies? Do we have a screening test for measles? Do we have a screening test for let's say HIV? Do we have a screening test for diabetes? Why is it that we have a screening test for a couple of diseases, and why is it that we don't have screening test for the other diseases? Because it has to fulfill certain conditions. Low case fatality, बहुत कम केस फैटालिटी रेट है, 1 to 2%. It doesn't mean to have we don't need a screening test, because remember screening test should not be costly. It is applied on bigger populations. Now any disease that is 100% fatal like rabies, there's no point of having a screening test. ठीक है? Diagnostic tools not available. अब if I screen somebody, then I should have a diagnostic test to confirm that okay, this person has that particular disease. If I don't have a diagnostic test, no point. No effective treatment. अब बताओ, you have troubled the person so much, you tested him when he felt he was healthy, ठीक है, and now you're saying him that oh sorry, I don't have a treatment for this. It doesn't serve the purpose. So early diagnosis can change disease course because of effective treatment. Suppose if I'm able to detect cervical cancer at stage 1 and 2, and if I offer treatment, I can change the course. I can prolong the survival of the person. Am I clear, everyone? ठीक है? Also remember one thing over here, guys. Screening is which level of prevention? Can anybody tell me which level of prevention is a screening test? Which level of prevention? Rohit, I will be discussing your question. ठीक है? We have an MCQ on that. What will happen when cutoff is increased and when cutoff is decreased? It will come. Don't worry. ठीक है? So what is your answer over here? No doubt, guys. Secondary level. Okay? A couple of exceptions are there which you will get today. And remember one more thing. Secondary level means make an early diagnosis and treatment. and provide timely treatment, early diagnosis and treatment. So screening test always comes like health camps, health checkups, ठीक है, health camps हो गया, health checkups हो गया, annual health checkup हो गया, कोई भी चीज़ where we are trying to make an early diagnosis is secondary level of prevention. One more question over here. Screening test is applied. When do you apply a screening test? Screening test is applied. Do we have signs and symptoms जब screening test apply करते हो? No. Screening test is applied when no signs and symptoms are present. No signs and symptoms. Because once signs and symptoms come, why will I screen a person? I will diagnose a person. So remember all these points. Cervical cancer के findings अभी आए नहीं है. But the person, because the woman is sexually active, she might have acquired HPV and she might be at risk of cervical cancer. So couple of one-liners here. Screening test is secondary level of prevention. Screening test is applied when there are no signs and symptoms. Okay, going to the next one. Chalo, this is a baby question. It is a PYQ from all the exams. Yes, you apply screening test on the hidden portion. कल मैंने पढ़ाया था ना, ये आइसबर्ग अगर है, स्क्रीनिंग टेस्ट इज अप्लाइड ऑन दिस हिडन पोर्शन. ठीक है, हिडन पोर्शन. हिडन पोर्शन इज मेड अप ऑफ apparently healthy, those who appear to be healthy, and diagnostic test is applied on the tip when the people are symptomatic. So we have discussed iceberg yesterday. Very good. Lead time is first possible point of detection and the usual time of diagnosis. Now what is this? Option C क्या है? First possible point of detection and first critical point. Anybody? First possible point of detection and first critical point. ये क्या है? First possible point of detection and final critical point. Critical point of first possible time. Very good. This is nothing but this is your screening time. This is your screening time. Okay, so you have a lead time, you have a screening time. Now let's go by the image. ये किसका इमेज है एवरीबडी? सो कैन एनीवन टेल मी द लीड टाइम ओवर हियर? व्हाट इज द लीड टाइम इन दिस इमेज? व्हाट इज द लीड टाइम इन दिस इमेज? सो रिमेंबर, ए इज द डिजीज ऑनसेट, द एजेंट हैज कम इन टू माई बॉडी. बी क्या होता है? बी इज द first possible point of diagnosis. This I will revise in image class tomorrow also. ठीक है? First possible point of diagnosis. First possible point of diagnosis मतलब again there are no signs and symptoms. There are no signs and symptoms. ठीक है? What is X? X is the critical point of diagnosis. X is the critical point of diagnosis, everybody. And Y is the usual time of diagnosis. Y is the usual time of diagnosis. Usual time of diagnosis matlab S and S present, signs and symptoms present. So ideally we would always diagnose a person when he comes to us. ठीक है? So ideally diagnosis point Y पे होता, but now instead of point Y we will make a diagnosis at point B when the person does not have signs and symptoms. So we are early or we are leading in the detection of the disease by what time interval, guys? B to Y. So your lead time is B to Y. But हमेशा is it possible that every time I will apply my screening test at point B? नहीं. B is the ideal time to apply screening test. B is the ideal time to apply screening test. But many times the point B is missed. We just miss it. So if you want to get the advantage of screening test, you should apply it till point X. X क्या होता है? X is the critical point to apply screening test. X is the critical point to apply screening test. That means it is the optimum time. Optimum time. You should not miss it. If somebody next time they frame a question and they write over there, what is the ideal time to apply a screening test? Point B. But what is the optimum time? जब तुमको उसके beyond, मतलब उसके beyond we won't be able to give too much of an advantage. That is point X. Clear? And B to X is what? Screening time. Don't be in a rush while you're marking your answers. See, are they asking screening time? Are they asking lead time? ठीक है? Okay, now let's go to another image. This image I'll take up tomorrow also. What is the name of this image? अगर ये एग्जाम में आ गया तो इसको क्या लिखोगे? दिस इज एन इमेज ऑफ इंक्यूबेशन पीरियड, लीड टाइम. What is it? Anyone? I want the name of this image. Just I will discuss tomorrow also. Some more answers. Very good. Lokendra, very good. Lokendra has come up with an answer. Anybody else? रोहित का आंसर. लोकेंद्र, तुम्हारा आंसर सही था. योर आंसर वॉज एब्सोल्युटली करेक्ट डियर. इट इज natural history. Very good. You were the first one to write and you gave the correct answer. Kudos. Natural history of disease. Kudos to each one of you. All right. Natural history of disease. This is an image of natural history. Now, what are the couple of questions? Now, this can come in NEET PG भी and FMG भी. ठीक है, NEET PG also, FMG exams also. Now, what is natural history? Sometimes they ask you this definition: how a disease progresses without intervention. What is natural history of a disease? How a disease progresses. How a disease progresses without any intervention. Without any intervention. That is the meaning of natural history. Now, it means that suppose we don't vaccinate the children for measles, how will measles occur? ठीक है, how do we stop measles? By vaccinating the children. So suppose I don't vaccinate the children for measles, how will measles result? That is natural history. Next MCQ: which study design best is the best one to study natural history of a disease? Anybody? Natural history of the disease के लिए best study design कौन सी है? Best study design. This will be taken up tomorrow also in image. अब ये मत सोचना अच्छा यहाँ पे word history है so it could be case control. No, here the term is natural history. Natural history best study design is cohort. Temporality best study design is cohort. Natural history best study design is cohort, because in cohort only you divide exposed and non-exposed and then follow up. Got it, all of you? Okay, now come to the image. See, over here they'll give you the markings like this. A, B कर देंगे, C कर देंगे, D कर देंगे, and they'll ask you what are A, B, C, D. So the first stage is a stage of susceptibility. Stage of susceptibility means we are exposed to risk factors. So this stage, when we are exposed to risk factor, guys, occurs in the environment. So when we are exposed to the risk factor, what level of prevention can you apply over here? Anybody? When you are exposed to the risk factors or environment, what level of prevention can you apply over here? You can apply primary level. You are exposed to risk factors. Now pathogenesis is not happening. You can also call it as pre-pathogenesis phase. Pre-pathogenesis. Now what is A? A is exposure. Exposure means the agent has entered into my body. So immediately I'll not go on to develop signs and symptoms. We have a stage of subclinical disease where we are having early pathogenesis. Okay, the pathogenic changes have started. After pathogenic stages, finally we start getting onset of symptoms. After symptoms, you have the usual time of diagnosis, and then is running a stage of clinical disease, late pathogenesis. So over here, now what could happen? Finally, the outcome. The outcome could be a person can recover, get disabled or die. So over here, what levels of prevention would you apply, guys? We would apply secondary and tertiary level of prevention. Clear? Secondary and tertiary level prevention. Got it? This I'm going to talk about tomorrow also in the image based session, but right now, because you know many times students क्या करते हैं, कभी कभी lead time को natural history से confuse करते हैं. So once again everybody, this image is of lead time. This image is of natural history of disease. How a disease is going to progress without any intervention. Confused nahi hona. That's why I gave you both the images together today, so that you know you're very clear in the fact that this is natural history, and best study designed to establish natural history is a cohort study. Chalo, back to screening. Look at this and answer. Which statements are true for screening test? Difference between screening and diagnostic test. क्या हुआ? Nobody is answering. Okay, take your time. Study with Doc has come up with B. Sandesh has come up with B. Most of you are writing B. Alright. So now see, screening test. Obviously, you do it on apparently healthy. True. You don't do it on diseased. Diseased में आप diagnostic करोगे. Are they a basis of treatment? No. We never start treatment on the basis of screening test. There's only one screening test on the basis of which we start treatment, sputum. ठीक है, for AFP, Basler. Most more costly, no. Remember, you're applying it on apparently healthy people. मेरे हिसाब से मैं ठीक हूँ, मेरे को कुछ नहीं हुआ है, ठीक है. So if I have to, there are so many people like me who might be thinking, okay, I'm healthy. So if a screening test has to be conducted, you can't expect it to be a very costly test, because we have to apply on larger population. Comparatively inaccurate results, everybody. Comparatively inaccurate results based on one criterion, cutoff point. So now comparatively, do you get inaccurate results over here? Inaccurate results. Now if you compare inaccurate results, ठीक है, and based on, so let me do one thing, let me take you to a table. See, done on apparently healthy, done on those with indications of sick. Clear? Applied to groups, applied to single patients. Test results are arbitrary and final based on one criterion cutoff point. जैसे अगर मैंने बोला that screening test 1 by 120/80, all those who are 120 more than 120/80 are positive, those who are less than 120/80 are negative. So it is final. Alright, but diagnosis is not final. Diagnosis, if suppose MRI points cancer, we can't say that, oh, I don't have cancer. But the clinician will still consider the signs and symptoms, because that time we have signs and symptoms. In screening test, we don't have signs and symptoms. Look over here. So one common mistake that a student can do during exam, वो ये वर्ड देखेगा फाइनल एंड ही विल थिंक कि फाइनल इज फॉर डायग्नोस्टिक टेस्ट. नो, हियर वी आर टॉकिंग अबाउट स्क्रीनिंग टेस्ट रिजल्ट्स. स्क्रीनिंग टेस्ट रिजल्ट्स फाइनल होते हैं. डायग्नोस्टिक टेस्ट रिजल्ट को वी मॉडिफाई इन द लाइट ऑफ साइंस एंड सिम्टम्स एज वेल. Screening test less accurate, more accurate. Less expensive, more expensive. Self-explanatory. Not a basis of treatment, used as a basis of treatment. And the initiative comes from the government or NGO, things like that. Here it is from a patient with a complaint. Am I clear, everyone? So let's go back to this. Now, comparatively inaccurate results. So if you look over here, we are kind of getting like less accurate, है ना. Results इसके less accurate होते हैं. So this again is true. Based on one criterion or cutoff point, it is also true. So what is the correct answer over here? 1, 4 and 5. You have to consider it when you are comparing with a diagnostic test. Now did all of you understand? Will you remember this go-to table for exams? This is a 3-star table, guys. इसको पढ़ के जाना. Now this we've already discussed. A couple of definitions I'll take up. I'll be doing numericals also today. Don't worry. Give me the answer to this, guys, as quick as possible. But don't mark it wrong. Ability of a screening test to correctly identify those without the disease is known as. Good. Without disease, specificity. अब एग्जाम में इसको with disease मत पढ़ लेना और sensitivity मत लगा के आ जाना. Sometimes it happens. So read the question carefully. It is saying without. Without means specificity. With disease means sensitivity. The formula is already done. PPV means my screening test is positive. Do I really have the disease or not? NPV means screening test is negative. Do I really not have the disease? That is NPV. Okay, now do this one. If a patient tests positive for a disease, which of the following represents the probability of her actually having the disease? So my screening, the word probability, very good. The word probability goes with predictive values. So I have come screening test positive. Do I really have the disease or not? Positive predictive value. I have come screening test negative. Do I really not have the disease? What is that, everybody? Negative predictive value. So over here the answer is PPV, and also if we are saying screening test negative but you really not have the diseases, negative predictive value. Answer. Another 3-star question, instead of asking you the definition, they can ask you like this, and you know it, trust me. Answer kya hai iska? What is the meaning when I say that okay, a disease is 90% specific, or I say 90% sensitive? What does it mean? What does it mean? Okay, very good guys. Now you all know what is the formula for specificity, Didi? Okay, what is the meaning of, what is the formula for specificity guys? So specificity hota hai Tn upon Tn plus Fp. So अगर मैंने बोला that a disease is 90% specific, what does it mean? It means that if the screening test is applied, all right, if the screening test guys, if the screening test is applied on 100 non-diseased individual, diseased mat likhna, 100 non-diseased individuals, it will identify 90 as true negative and remaining 10 as false positive. क्योंकि definition में देखो Tn upon Tn plus Fp. So if I apply it on 100 non-diseased, it will give me 90 as true negatives and remaining 10 as false positive. Now suppose I say that sensitivity is, let's say, 90%. Okay, what does this mean? It means that if test is applied on 100 diseased, ठीक है, sensitivity क्या होता है? TP upon TP plus FN. So if I apply it on 100 diseased, I will get 90 as true positives and remaining 10 as false negative. Clear everyone, this interpretation? So over here it was 90% specific, so this will be 90% of non-diseased persons will be true negative. Anyone who did not get it, just note it down. Let me finish the session. I will explain it to you once again. This is because this is the basis. Okay, chalo, let's go to the next one. 1 second, okay, you'll have to give me 1 moment please. इसका आंसर करो गाइज. एक सेकंड रुक जाओ. Okay, what is the answer over here, everybody? Reliability does not mean validity. Now over here, what are the 3 properties of a screening test? What are the properties of a screening test? The mnemonic for the properties are ARV. A से हो गया acceptability. This is most important because screening test is applied on apparently healthy people, so it should be acceptable to me that okay, because I don't have a disease. If you do some very painful technique on me, I will not agree to it. ठीक है? R means reliability. The findings should be reliable. In similar settings, we should get the same result again and again and again. Reliability, reproducibility, repeatability. ठीक है? And the last one, we say validity. This is also known as consistency. This is also known as precision. Every day if you are studying for 2 hours, every day you should study for 2 hours. That's what is consistency and precision. Validity का दूसरा नाम क्या है guys? Accuracy. Validity का दूसरा नाम is accuracy. And validity includes, what does validity measures? Validity में तुम्हारा आता है sensitivity, specificity and also the predictive accuracies. So don't forget these terminologies, they are very important. ARV, ठीक है, ARV के order में चलो डॉक्टर दीपांशु, because acceptability सबसे important है. Next time they can ask you a question which is more important. It is acceptability, that's the first thing. Okay, all right, let's go to the next question. All comprise inherent properties. Now just taught you, so what is the answer here? All comprise inherent properties of a screening test except. Very good. अभी पढ़ा हमने what are the inherent properties of a screening test is ARV. Acceptability, reliability, validity. Yield is not a property. Yield means the advantage, the gain due to a screening test. What is yield? Yield is the advantage, or you could say the gain due to a screening test. What is it that we are getting because of applying the screening test? So the cases that were earlier missed, cases missed earlier, now recognized. Cases missed earlier, now recognized due to a screening test in place. Now recognized due to a screening test in place. पहले जो केसेस मिस्ड हो रहे थे, ठीक है, वो अब रिकग्नाइज हो रहे हैं बिकॉज वी हैव अ स्क्रीनिंग टेस्ट इन प्लेस. ठीक है, alright, what is the next one? Quickly answer. Which of the following represents the diagnostic power? If you ever see the word diagnostic power, what will you put your answer as? ये कौन है, क्यों नहीं? Don't get distracted guys, exam is just right ahead, no more changes. ठीक है, पढ़ते रहो अच्छे से. What is the answer over here? Diagnostic power, predictive accuracy. Diagnostic power, predictive, which is reflected by two things, PPV, NPV. PPV is the probability to correctly include the disease, correctly include. And what is NPV? NPV is correctly exclude. ठीक है, NPV is correctly exclude. All these are one-liners, can also turn up in your exams. But अगर कोई आपसे एग्जाम में पूछ ले most useful property of a screening test, आंसर क्या होगा? Most useful property of a screening test. What are you going to mark then in the comment section quickly? Most useful property of a screening test. Waiting. Most useful property. Most useful property of a screening test क्या होता है? Sensitivity. Alright, most useful property of a screening test is sensitivity. We should not miss out people who are developing the disease. But diagnostic power of a screening test is always reflected by predictive factors. Chalo, back to a numerical. Let's see. Take your time. Don't make a mistake, guys. Try to, figure out the values. What all values have been given to us. ठीक है, now I know it could be tough, but हमें कैलकुलेटर मिलता है. Try to figure out A क्या है, B क्या है, C क्या है, D क्या है, specificity का formula क्या होता है. ठीक है, just try to figure out that and then you will be able to mark it. A total of 2,000 patients were assessed for HIV. 200 were diagnosed positive. ठीक है. Now tell me, and then I am assessing 2,000 patients. I am testing for HIV. 200 people have been diagnosed. ठीक है. तो what is 200, what is 2000, and then I do a ELISA and I see that 260 positive आए हैं जिसमें से 130 had the disease. How are you going to calculate? Now what is this 2000 guys? It's the total population, A plus B plus C plus D. Now how many were diagnosed positive? 200. So what is 200? Is it A plus B or is it A plus C? What is 200? Is it A plus B or is it A plus C? 200 क्या होता है? 200 are, is it true positive? Is 200 true positive? No. 200 are diagnosed positive. This is A plus C. A plus C. Now when I apply a screening test, okay, a new ELISA screening test was tested on the same group. It showed 2, see अभी मैं 2 by 2 table नहीं बना रही, but I will show you a 2 by 2 table. Try to figure out without 2 by 2 table once. It showed 260 as positive. Now tell me what is 260? It is ELISA positive. So is it A plus B or is it A plus C? ELISA positive. This 260 क्या है? This is A plus B. And out of that, only 130 had the disease. What is this everybody? This is your true positive or A. Think. Now see, your disease is always on the column side. So this is yes, no, and your screening test result is always on the row side, positive, negative. We just learned the order A, B, C, D. A क्या होता है? TP, B क्या है? FP, FN, all negatives in the second row. ठीक है? Clear? Now I said 200, okay, one second. Now I said that, yeah, now I said that 200 are diagnosed positive. तो मेरा 200 यहाँ है. And ELISA test when I put, okay, ELISA test जब apply हुआ, then what happened? It showed 260 as positive. So ELISA positive 260. Out of that, how many had the disease? 130. Now what is specificity? So you need TN to calculate specificity. अब अगर ये 200 है, altogether there are 2000. So this is how much? 1800. Now if this is 260, this is 130 guys. So how much is this? This is also 130. Now how much will TN be? 1800 minus 130. So when you do 1800 minus 130, it will be 1670, and they are asking you specificity. So specific 1640. Yeah, they are asking you specificity. So that will be how much? 1640 by 18 by 1740 क्यों कर रहे हो? 1640 नहीं है, 70. ठीक है, 1670 by the total. The total is how much? The total is 1800 into 100. This is hardly there is any difference. So more than 90%, 96%. फिर से बताओ. Don't panic when you get a question guys. आएगा तो करना तो पड़ेगा ना, है ना? We will have to do it. I have brought out 1 or 2 more questions for your revision which we will do. Just try to figure out the values. ठीक है, यहाँ पे आपको दिख रहा है, you can see there are 2000 people. That's the total population. 200 are diagnosed positive. That means 200 have HIV. Now when I apply ELISA, I see 260 come out to be positive. That means ELISA positive, A plus B is 260. Out of that, 130 had the disease. So 130 is your TP. Is it clear? Everybody, did you understand this question or not? C plus D क्या है? C plus D तो कुछ नहीं है. C plus D is ELISA negative. यहाँ पे हम लोग को क्या दिया हुआ है? A new ELISA test was tested on the same group. It showed 260 as positive. So A plus B is positive. ठीक है? I know. Let me give you one more question. You ready? अच्छा, पहले 1-2 और सवाल करते हैं, then I'll give you a question. ठीक है, देखो, all together 2000 people. Read with me once. A total of 2000 patients were assessed for HIV. 200 were diagnosed positive. That means 200 are positive. Disease, yes, 200. Now I'm trying to do an ELISA. ELISA say I come out 260 as positive. ELISA gave me 260. ELISA is a screening test, but out of that only 130 actually have the disease. Got it? So these values were given. Now 200 is those who are having the disease. So how many don't have the disease? 1800 minus 200. ठीक है, 1670. 1800 जो है उनको डिजीज नहीं है, तो TNS में से भी कैलकुलेटेड 1670. क्लियर? चलो कोई बात नहीं, 1 मिनट लगे 1.5 मिनट लगे, इट्स नॉट नेसेसरी. अब अगर ये क्वेश्चन आ गया, इसमें तुमको 1 मिनट तो लगेगा नहीं, यू विल बी एबल टू मार्क इट इन 15 seconds. सो रिमेंबर, अ क्वेश्चन माइट टेक 1 मिनट, बट सम क्वेश्चन माइट ऑल्सो टेक 10 seconds और 12 seconds. ठीक है? I'll tell you once again, don't worry. Sensitivity का formula क्या है? Why am I getting A as the answer? Sensitivity is TP upon TP plus FN into 100. TN plus FP. This is specificity. Remember, PPV क्या होता है? They all positives. NPV क्या होता है? All negatives. Next question. Already done it. Just quickly tell me the answer. B to Y क्या होता है? What is B to Y? Then I'll go to numericals. What is B to Y? Already we have discussed. B to Y क्या है? Good. B to Y is lead time. कल हमने पढ़ा था ना, generation time, the time between entry of organism till maximum infectivity. That is your generation time. Okay. Positive predictive value is most affected by 4-star question. All the exams give you this question. Positive predictive value is more affected by, what is it? What is your answer over here? Whenever you get a question related to PPVs, NPVs, very good. Whenever you get a question related to predictive values, the first thing that you should know, PPV, because exam is very near, directly proportional to prevalence. NPV, indirectly proportional to prevalence. Sensitivity and specificity of a test. Sensitivity and specificity of a test, all right, of a test, independent of prevalence, independent of prevalence. Sensitivity and specificity prevalence से लेना देना नहीं है. Suppose if sputum has a sensitivity of 70%, if there is a community where prevalence of TB is 50%, the sensitivity of sputum will be 70%. If there is a community where prevalence of TB is 90%, still sputum की sensitivity वही रहेगी 70%. Clear? Sensitivity and specificity of a test are independent of prevalence. Prevalence, the first thing that gets affected by prevalence is your predictive values. PPV directly proportional, NPV indirectly proportional. Clear? Got it everyone? Chalo. Now think and answer this. In a population, a screening test has a high false positive. It's not difficult, trust me. Which of the following is it most likely to be affected? कैसे करोगे इसको? सोचो, where do you take false positive? In which formula do you take false positive, guys? Which formula do you take false positive? So you all know specificity. Specificity होती है TN upon TN plus FP. Now if FP is more, obviously if false positives are more, that means true negatives are less. And what is true negative? True negative is nothing but specificity. So what is it that's going to get affected? Specificity. अगर question आता high false negative, तो क्या affect होता? If the question was high false negative, what would have been affected the first one? So we all know sensitivity क्या होती है? Sensitivity is TP upon TP plus FN. So if FN is more, TP would be less. That means sensitivity would be less. So don't panic when you get a question like this. Just think where was false positive and where was false negative. Okay? Okay, one more tricky question. Let's see if you can do this. I'm trying to show you the different types of questions that have come in all the exams, guys. Okay. Right, so we need to buck up a little. A point of care डायग्नोस्टिक रटना नहीं, ये PYQ है, बट इट्स नॉट फ्रॉम FMG एग्जाम्स, बट डोंट रटोफाई दिस. और पॉइंट ऑफ केयर डायग्नोस्टिक टेस्ट बोल रहा है 98% सेंसिटिविटी. दैट मीन्स इट हैज सच अ गुड, एनी टेस्ट विच इज लाइक बियॉन्ड 75% सेंसिटिव इज अ गुड टेस्ट. सो दिस हैज 98% सेंसिटिव. दैट मीन्स it has high chance of giving people as true positives, high chance of finding people true positive, but unfortunately इसमें क्या हो गया, इसने negative result दे दिया. What does this mean? What does this imply about the patient's likelihood of having the disease? The patient is less likely to have the disease. Prevalence of the disease पे hint कर रहा है. Patient would need another point of care diagnostic test. Patient has been wrongly ruled out at false negative. No. Now see, we don't need another test. The test is 98% sensitive. So if somebody comes out to be negative, high chance है कि वो क्या है, false negative. So the patient is less likely to have the disease. See, what was sensitivity? TP plus FN. Now if any test is like 98% sensitive, that means if I apply it on 100 diseased people, I will get 98 as true positives and 2 as false negative. So maybe those who've come out false negative, alright, is less likely to have the disease because the sensitivity was too high. Clear? So don't worry, just follow it. Alright, which of the following is an example of prospective screening? Prescriptive and prospective screening. Let's quickly do this. Which out of the following is an example of prospective screening? What is the answer to this? Prospective screening is done for one's own benefit. One's own benefit. So screening of immigrants in a country. Now there are two types of screening. If you remember guys, there is a prospective screening. There is, prospective we are talking for others benefit. Yeah, prospective screening is done for others benefit, and there is another screening, prescriptive screening. Prescriptive. Now prospective screening is done for others benefit. Prescriptive screening is done for one's own benefit. ठीक है. Now prospective screening का पर्पस होता है डिजीज कंट्रोल करना, डिजीज कंट्रोल. प्रिस्क्रिप्टिव स्क्रीनिंग का पर्पस होता है मेक एन अर्ली डायग्नोसिस, मेक एन अर्ली डायग्नोसिस. नाउ वी ऑल नो गाइज, स्क्रीनिंग क्या है, सेकेंडरी लेवल प्रिवेंशन. बट नाउ व्हेन यू लुक एट प्रोस्पेक्टिव, यू आर स्क्रीनिंग पीपल, immigrants in a country. COVID के लिए airport पे we were screening because they were a risk factor for the others. So this is one exception where a screening becomes primary level of prevention. Prescriptive screening is to make an early diagnosis, pap smear, neonatal screening for sugar. This is what secondary level of prevention. Screening is always secondary level, but this is one exception. Prospective screening is, although we are doing an early diagnosis, it is a primary level of prevention. Am I clear? Everybody, did you understand this question? ठीक है. ANC चेकअप, HIV स्क्रीनिंग, ANC फीमेल, HIV स्क्रीनिंग, ANC फीमेल, किस तरीके का स्क्रीनिंग है? HIV टेस्ट इन एन ANC फीमेल इज विच टाइप ऑफ स्क्रीनिंग? इट इज फॉर द बेनिफिट ऑफ द बेबी. दिस इज प्रोस्पेक्टिव. इट इज फॉर द बेनिफिट ऑफ द baby. All right. So that is prospective. Okay, let's see another question. A test which produces similar results when repeated but values obtained are not close to the actual. This is termed as. A test which produces similar results when repeated. बार बार एक ही result दे रहा है, but values obtained are not close to the actual. So what is this? Good. It is reliable, precise, but it is lacking validity. It is not getting closer to the gold standard. So it is inaccurate. Good. I know you can do this one. Alright. Two doctors were asked to read and report x-rays kappa value. Now what is kappa stats? Please don't think कि kappa stats NEETPG या FMG में नहीं आ सकता. They might not give you the calculation, but they can give you what is the purpose of calculating kappa statistics. Kappa statistics क्या check करता है? Okay, you all have learned this thing. It's good. Kappa statistic checks the level of agreement between two observers beyond chance. Okay, level of agreement between two observers beyond chance. It's something which is commenting on the reliability of findings. जैसे इंटर ऑब्जर्वर वेरिएशंस, ठीक है, इंटर ऑब्जर्वर वेरिएशंस, वी कैन हैव इंटर ऑब्जर्वर वेरिएशंस, वी कैन हैव इंटर ऑब्जर्वर वेरिएशंस. Like I can say a person is anemic, the other one can also say a person is anemic. We might end up saying the same thing due to chance, but when we agree beyond chance, it is reliability, it is kappa statistics. And you should always remember that strength of agreement kappa statistics के लिए we should at least have a value of 0.7. ठीक है. So for your FMG, oh sorry, I missed one, I will take up that. One second. Kappa statistics, you have to remember it checks the level of agreement between two observers beyond chance. Remember the word kappa statistics, commenting on reliability. Okay, this was missed, sorry. Give me the answer to this. After visiting a village for screening where many people have diabetes and hypertension, what type of screening would you conduct for the family members of these patients who arrive in large numbers at your clinic? It's not very difficult. इसका आंसर क्या है? Okay, so we have 10 more minutes on the clock. Let's do it a little speed up. Good, good. ये क्या हो रहा है? ये क्या हो रहा है? Somebody is, guys, please read the question again. I have just twisted and turned the question a little bit. I want somebody to be giving a correct answer over here. You are screening. Whom are you screening? Fair. Very good, Tanishka, Riri. I am not going to be there in the exam with you, na? So, मतलब कैसे? How could you immediately mark mass screening? Mass screening is everybody irrespective of high risk. Here I just twisted the question. Many people have diabetes एक village में. What type of screening would you conduct for the family members of these patients who arrive in large numbers at your clinic? So you're going to do it for the family members. So what type of screening are you going to conduct over here? This was a high risk. It was written that there is a village where the diabetes and hypertension बहुत ज़्यादा है. So इन लोगों के family members के लिए तुम कौन सा screening conduct करोगे? Obviously high risk. ठीक है? अगर मैंने बोला होता a village में diabetes and hypertension is a lot, I am screening everybody. What is that? Mass screening. But if I screen people beyond 60 years in that village, what is that? High risk screening. हाई रिस्क स्क्रीनिंग का दूसरा नाम क्या होता है? सिलेक्टिव स्क्रीनिंग. हाई रिस्क स्क्रीनिंग का दूसरा नाम है सिलेक्टिव स्क्रीनिंग. ओके, don't get caught up in this. Okay, ROC curve can illustrate the performance of a diagnostic test. Identified the incorrect statement on ROC curve. So I'll show you the image of ROC curve. I'll show you the image of Kaplan-Meier. Okay, because even if it's FMG exam, even if it's NEETPG exam, ROC, Kaplan-Meier, kappa stats, कम से कम नाम कोई भी एग्जाम में आ सकता है. It can come in image or it can come in NEETPG also, FMG exam also. Incorrect statement. Incorrect. You're not reading the question, guys. ROC curve can be used to compare two or more diagnostic tests. Very good, Dipanshu, and very good, Rohit. Very good, Exportin, Dr. Kalgi, Nazia, Shalu. मतलब बार बार सोचना है. ROC curve क्या बताता है? This is your ROC curve. Alright. ROC curve helps you decide cutoffs. Helps you decide cutoffs. And remember what is on the x-axis? False positive rate. What is on the y-axis? True positive. True positive means sensitivity. And what is false positive? I can also write 1 minus specificity. और फिर मेरे पास यहाँ दो कट ऑफ्स है, A and B. Now which one is better? Because exam is very near, that curve which has more area under it. So which curve has more area under it? Curve A. It is better. Curve A has more sensitivity and less false positive. Curve B का less true positive है and more false positive है. उससे बेहतर तरीका क्या है? How do you decide the cutoff? You just have to look at the area under the curve. So now look over here in the question. ROC curve can be used for comparing diagnostic tests. Yes. ROC curve can be used for deciding the cutoffs. Yes. The best investigation is the one whose curve is most upward and left. You can see most upward and towards the left. Okay? Next, test with minimum surface area under the curve is more effective. Wrong. Test with more surface area. What is the full form of ROC? Good, Riri. It is receiver operator curve. Receiver operator curve. कोई भी टेस्ट के लिए वी कैन हैव लाइक कोई भी डिजीज के लिए वी कैन हैव 2 or more than 2 tests. We can have more cutoffs. So to decide which one is the best, we construct the ROC curves. Clear, everybody? More the area under the curve, the better it is. What is the name of this image? Kaplan-Meier. Now what does Kaplan-Meier tell us, guys? Kaplan-Meier क्या बताता है? If anyone in the class can quickly tell me. Kaplan-Meier is the one which tells you about good survival. Kaplan-Meier बताता है survival. You could get a question. Kaplan-Meier is for incidence, prevalence. It's like people who undergo a screening test, how many more years they are living. ठीक है? So Kaplan-Meier is for survival. Yes, area under the curve is given by Uden's index. Area under curve in an ROC. ठीक है? In a ROC, area under the curve is given by something known as Uden's index. This I don't think they should ask in FMGE or NEETPG. Sensitivity, उसका formula होता है sensitivity plus specificity minus 1. ठीक है? So this I don't think they will ask in this one. Alright, what is the answer to this? Deciding cutoff का मतलब होता है ना, you can have 120, 80 as the cutoff, 110 and 70 as the cutoff. So which one do you want to keep? So the software will construct ROC curve and give it to me. Okay, now cutoff of a screening test is lowered. What will happen? Let me explain this question quickly to all of you. ठीक है? देखो guys, ideal situation में this is a cutoff. Let's say this is 120, 80. So all those, listen to this very carefully, all those more than 120, 80 are true positives. All those less than 120, 80 are true negatives. But for a screening test, this is not possible. Why? Because with true positive, you will also get some false negative. And with true negative, you will also get some false positive. है कि नहीं? For a screening test, this is a diagnostic test. This is not possible. So what happens in a screening test? See, this is your cutoff. Now you will get to label the areas. Cutoff. Now all those, my cutoff is 120, 80. So all those who are more than 120, 80 are what? True positive. More. ठीक है? More true positive. But sensitivity क्या होता है? Sensitivity is TP upon TP plus FN. So some are false negative, they will go on the negative side, a smaller portion. All those who are less than 120, 80 are true negatives. But along with true negative, specificity क्या होता है? True negative upon true negative plus false positive. You will get some false positive which is on the smaller side. ठीक है? So on the right hand side is the true positives and the false positives. On the left hand side is the true negatives and the false negative. Now if I increase the cutoff, let's increase the cutoff. So I increase the cutoff से 200 से 100 कर देती हूँ. Now which side increases? If my cutoff shifts, the left hand side, this side increases. So when I increase the cutoff, guys, less people will fall in the range. 200 by 100 जाने के लिए time लगेगा. So what increases? TN increases. TN increases and what decreases? FP decreases. So if TN increases means क्या होता है? Specificity increases. If specificity increases, automatically sensitivity decreases. But if I lower the cutoff, if I lower the cutoff, मान लो मैं cutoff कर देती हूँ 90 by 70. So if I lower the cutoff, the right hand side increases. If cutoff lowered, what is increasing? The right hand side. That means TP increases, FN decreases. If TP increases, what increases? Sensitivity increases, which automatically means क्या decrease होता है? Specificity decreases. And when do we keep a lower cutoff, guys? We keep a lower cutoff जब वी हैव हाई प्रेवलेंस, ठीक है। लोअर कट ऑफ रखोगे जब प्रेवलेंस हाई होता है। गॉट इट? यू शुड नो दिस इमेज गाइस। कट ऑफ यहाँ है, all the people who are more are true positives, all those who are less are true negatives. Now if I increase the cutoff, the left hand side increases, true negatives increases. If I decrease the cutoff, more and more people will fall into the range, so true positives increases. Am I clear everybody? So the question here was, the question that was asked to you was lowered. So you've lowered the cutoff. What side is increasing? The true positives. Sensitivity increased, specificity decreased. ठीक है? Okay. Can you try this image? Can you try this image, everybody? After this, I'll be able to give you 2 numericals. In the PDF, you'll find 1 or 2 extra questions. Try it out. If you don't do it, if you're not able to do it, you can let me know. सोच के करना गाइस, बहुत मुश्किल नहीं है. So you had a standard investigation which is given by blue color. Now you've applied a new investigation which is given by red color. क्या होगा? देखो, देखो. Now when you apply the new investigation, you can very well see which area has decreased. This one and this one. That means ये वाले एरियाज क्या थे? ये वाले एरियाज फॉल्स पॉजिटिव और फॉल्स नेगेटिव थे. So when blue say we shifted to red, what decreased guys? False positive decreased. It was not difficult, ठीक है? False positive decreased, false negative decreased. If false negative decreases, that means true positive increases. If false positive decreases, that means true negative increases. तो क्या बढ़ गया है? High sensitivity and high specificity. Previous मैंने गलत मार्क कर दिया. Oh, sorry. Yeah. Okay, sensitivity increased, specificity decreased. ठीक है? Now look over here. Everybody, look at this question. You just have to note this portion. ठीक है? If you look at this portion from blue to red, red में false positive, false negative decreased. That means TP and TN increased. So what has increased? Sensitivity and specificity. So what is the answer over here? High sensitivity and high specificity. Okay? Alright, quickly tell the answer to this. If multiple tests are performed in series, which of the following statements is correct? In series, if we apply the tests in series, which statements are correct? What happens when you apply the tests in series? Test in series means sequential testing. Sequential testing means one after another. Second test you will apply on only those people who are positive on the first test. So you will be able to filter out less people. So when I apply on series, sensitivity को क्या होता है? Decrease हो जाता है. Specificity क्या हो जाता है guys? बढ़ जाता है. But in parallel, it is simultaneous testing. We will apply both the tests together. So what will happen to sensitivity? We'll be able to filter out more people. It increases. Specificity decreases. This we have run n number of times. We're not going to go into too much of details of this question right now. Now I'm going to give you 2 more numericals. Quickly do those numericals. Then we'll call it a day. Let's see if you can do this. सीरीज में ऐसे याद रखना, वन आफ्टर द अदर, सो यू विल बी एबल टू फिल्टर आउट लेस पीपल. पैरेलल एक साथ चल रहे हैं, वी आर वॉकिंग टुगेदर, मोर फन, फिल्टर आउट मोर पीपल. ओके, हैव यू कैलकुलेटेड सुवर्णा? हैव यू ऑल कैलकुलेटेड योर आंसर्स और यू जस्ट रैंडमली टेलिंग मी दैट इट इज ऑप्शन बी? मैम आपने कैलकुलेट किया है? Have you made your 2 by 2 table? Have you tried to figure out? Let's do it together, all of us. Good. If you calculated, very good. Let's try to do, because I'm getting 2 answers over here. B भी आ रहा है, C भी आ रहा है. देखो, a screening test was carried out among 114 people. Now again visualize what is 114, a plus b plus c plus d, है ना? ठीक है guys, out of which 15 have the disease. What is 15? A plus c or a plus b or a plus c? What is 15? It's clearly saying screening test is carried out इतने में, out of which 15 have a disease. So 15 तुम्हारा क्या है? If you look at 15 को disease है A plus C. Test showed 22 people tested positive. Again, how many people tested positive? 22, A plus B. Out of that 14 had the disease A. अब calculate करो, just give me 1 second. कितना ले आओ नेको को? फिर से सोचो everybody, what is the sensitivity of the test? Let me make it for you once again. This is disease, yes, no. This is screening test, positive, negative. A, B, C, D, ये हो गया तुम्हारा TP, FP, FN, TN. 15 have a disease, that means 15. 22 people tested positive, that means 22. जिसमें से 14 actually had the disease, 14. What is sensitivity? You can't see it, right? What is sensitivity? What is sensitivity, guys? Sensitivity is nothing but 14 by 15. You don't need to calculate. It is going to get you around 14 by 15. It is 93. नहीं, sensitivity and specificity of a test are independent of prevalence. Everybody, did you get this question? समझ में आया ये वाला question, guys? Try to figure out. एक और question दूँ? Okay, so we don't have too much of time. I'm just going to quickly give you one more question. CA 125 is a marker of, कोई बात नहीं सुवर्णा, we'll keep practicing बच्चे, all right? घबराओ नहीं, go back home. I mean, once we finish the class, go through both the numericals. ठीक है? Yeah, CA 125 is a marker for screening of ovarian cancer. To characterize this test, histopathological confirmation of ovarian cancer was done in a cohort of patients. 60 by 100 women who tested positive for this test actually had ovarian cancer. So how many women actually have ovarian cancer, guys? How many actually had ovarian cancer? 60 by 100 women had ovarian, and 20 by 100 women who tested negative. तो इसमें क्या हो रहा है? 100 are tested positive, उसमें 60 had ovarian cancer, and 100 are tested negative, उसमें 20 had ovarian cancer. All right, this is ovarian cancer. Yes, no. This is the test, histopath, all right, whatever. So if you, let me make it for you nicely. See, all those who've been tested. So let's talk about disease. Yes, no. Screening test, positive, negative. Now 60 by 100 women who tested positive. So 100 women tested positive. This is 100. A, B, C, D. उसमें से 60 को cancer है. And 20 by 100 women who tested negative. So how many tested negative? Everybody, again 100. उसमें कितने को cancer है? 20. Disease, yes. Now I'm asking you negative predictive value. So I needed this D. So what is this D? 100 minus 20, 80. So what is this? 80 by 100. Yeah, we will have numerical lecture. You don't have to worry. Alright guys, anybody has any doubt? Okay, one last question for the day. Can you identify this one? Thoda sa think and mark it. What if they give you something like this? देखो, प्रिडिक्टिव वैल्यू डायग्नोस्टिक रिजल्ट होता है, ठीक है? सपोज माई एलाइजा हैज़ कम आउट पॉजिटिव, सो इफ द सेंसिटिविटी इन अ वे इज हाई, ठीक है? जैसे वी हैड द क्वेश्चन, लेट्स से द सेंसिटिविटी ऑफ सम स्क्रीनिंग टेस्ट इज 98%, देर आर मोर चांस ऑफ मी हैविंग द डिजीज, there is more chance of me likely being positive. That means PPV would be high. ठीक है, बट अगर सेंसिटिविटी लेस है, लेस चांस ऑफ मी हैविंग द डिजीज. सो ऑफ कोर्स prevalence sensitivity is going to give you a hint on PPV. Specificity is going to give you a hint on NPV. Clear? Good. ये तो ऐसे ही था 120, 120, 80. So every time I have the same values and near to the gold standard, precise and accurate. 140, 96, 108, 62. Every time I've got wrong, imprecise and accurate. 140, 96, 140, 96, 140, 90, 140, 96. Okay. So this one over here is what? Every time the same but not closer to the gold standard. And what is this? Every time different but closer to the gold standard. So option D. हाँ, तो नेगेटिव प्रेडिक्टिव वैल्यू ही तो हमने यहाँ पे निकाला है ना, 80. ठीक है, इसमें बोला था 20/100 वुमन हु टेस्टेड नेगेटिव. सो 100 टेस्टेड नेगेटिव, आउट ऑफ विच 20 हैव द डिजीज एक्चुअली. सो 20 क्या है? दिस वन, फॉल्स नेगेटिव. ओके, चलो, so that's it. This is the image that you can do, guys. Now, which of the following best describes relationship between positive likelihood ratio and the probability of disease? Higher positive likelihood ratio, अगर किसी का positive likelihood ratio आएगा, makes the probability of the disease less likely when the test result is positive. A higher likelihood ratio makes the probability of the disease more likely. Of course, it makes the result more likely when the result is positive. Like suppose likelihood ratio का मतलब क्या होता है? What are the chances of me, if my screening test is positive, what are the chances of me actually having the disease? That's only likelihood ratio. ठीक है, so if it is high, the chance is more. If it is low, the chance is less, everybody. ठीक है, I'm going to write the formula for positive likelihood ratio over here in case somebody wants to read it. Not very important for your NEETPG or FMGE exams, because this is more important for your INI-CT. But क्योंकि we are talking about all these things, so we are right. Alright, so that's it for today, everybody. ROC curve का image, Kaplan-Meier curve का image, Kappa statistics, do revise and go. All the formulas, try solving the numericals. ठीक है, tomorrow is a very big day because tomorrow we will be meeting for an image based session. देखो, अगर कट ऑफ को बढ़ाते हो, ठीक है, so this side increases, more true positives. Alright, if you increase the cutoff, this side increases. Less people will fall on the range, so true negatives बढ़ जाता है. But अगर तुम cutoff को घटाते हो, more people will fall on the range, so true positives increases. Alright, everybody. Which numerical? 2000 question वाला कौन सा था? Whatever I have taught now, just go through that cutoff wala question and you will be able to do it. Now see, 2000 patients, that means total population, 200 were positive. So it's written 200 positive. So disease, yes, below that only you will write 200. Now when I applied an ELISA, alright, 260 were tested positive. So positive is this 260. Out of this, actually 130 had the disease. So 130 is your TP. Rest of the values you can calculate. ठीक है, so image based revision कल है everybody. इसको whatever I taught, no, whichever question you have a doubt, just listen to it once again. Tomorrow don't forget to attend the session, ask your friends also to do. I've compiled all the images together. We'll be doing the name of the images, what it is for, and you'll be good to go with all the images at one place. All the latest updates of images are also there. Any new image which has been added in PSM will also be there. ठीक है, yes, I will. Kappa stats, just listen to it, what I have taught right now, you'll be able to do it. ठीक है, time is same, time सबका same है, 12 बजे tomorrow. Just tune in to Prep Ladder's YouTube. I'll share the link also. So bye bye guys, see you again tomorrow 12 PM Prep Ladder YouTube images.